So now we had seen about all the types of anemia also. So let's give a recap of the various shapes of RBCs which we had read about. So target cells are the ones which are going to look like this. The peripheral rim of cytoplasm is there, and then the center you are going to have this pinkish material. So these target cells are also given the name of podocytes, and they are going to be seen in thalassemia, megaloblastic anemia, and also in sickle cell anemia. Okay, any hemolytic anemia you can see target cells, but more often you can see it in thalassemia and megaloblastic anemia. Then sickle cells are going to be called as drepanocytes. So sickle cells are going to be seen in sickle cell anemia. Teardrop cells are called as dacryocytes. So dacryo, lacrimal gland, we call it as dacryo kind of thing, right? So anything related to the lacrimal gland pathology, we call it as dacryo. So teardrop cells, as the name suggests, teardrop is also looking like lacrimal, right? So these cells are called as dacryocytes. So teardrop cells are usually seen in myelophthisic anemia, primary myelofibrosis. Basically, any kind of myelofibrosis is going to be there. It is going to result in teardrop cells. Acanthocytes, which were also called as the spur cells, seen in A-beta lipoproteinemia and also in other liver disorders as well. Then echinocytes are Burr cells, seen in burns and uremia, also in sometimes liver diseases as well. So fragmented RBCs are the helmet-shaped or the triangle-shaped RBCs called as schistocytes, seen in microangiopathic hemolytic anemias. Then bite cells are also called as degmacytes. Then blister cells, again, they had this intact membrane over it. Both of it is going to be seen in G6PD deficiency. Then stomatocytes were actually the slit-like pallor cells, right? So they are going to be seen in hereditary stomatocytosis, also with alcoholism. So leptocytes are the RBCs with thin membrane of cytoplasm only. So only it is quite hypochromic. So it is going to be seen in severe IDA. Then spherocytes having no central pallor, just like that. It is just having the entire thing pink colored. So this is going to be more commonly seen in IHA. Then hereditary spherocytosis, G6PD deficiency, and also snake venom, burns. So Heinz bodies. So Heinz bodies was the denatured hemoglobin which we saw in G6PD deficiency. Howell-Jolly bodies are just DNA remnants. It can be seen in any conditions wherein splenectomy has been done. So splenectomy, it can lead to Howell-Jolly bodies. Apart from that, you can also see it in the thalassemia and megaloblastic anemia as well. Cabot rings are again remnants of nuclear material seen in megaloblastic anemia. Basophilic stippling, we can see it as either fine granules or a coarse granules. So fine basophilic stippling is going to be seen in thalassemia and megaloblastic anemia both. Okay. While coarse basophilic stippling is going to be seen in sideroblastic anemia and another cause of sideroblastic anemia, which is lead poisoning. Okay, so these are all the various types of RBC. It's just a nutshell here. So again, we saw many tests, screening tests, right? So again, that is a recap given here. So Nesterov test was the screening test used for thalassemia minor. MRT is methemoglobin reduction test, which is a screening test used for G6PD deficiency. Then sickling test, as the name suggests, it is going to be for sickle cell anemia. Direct Coombs test is going to be positive in autoimmune hemolytic anemia. Osmotic fragility test is going to be increased in HS. Okay.